Okay, so Miss Susan, just look at your profile here. All right, tap, 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 tap. Now, take the appliance out and do the same thing, but let your back teeth touch. Now put your lips down so that we can see how collapsed all that is. Now, tell me about the discussion you had about your jaw being forward and dentures, and just ad-lib it.
Worst case scenario is if you had to go with dentures, how it would line your jaw back up. But I don't know what you want me to say.
Okay, so the question was, if I had dentures, could you line my jaw up, upper and lower? And the answer is yes. And the dentist would go by your profile, which is you got the correct profile right now, but your teeth aren't touching.
Right.
Okay, so the bottom line is, that about the worst thing that can happen if we go this route, which is the appliance only, is that at some point in time only your front teeth would touch when you bit down, which you totally understand.
Yes.
You also understand that we could build your teeth up and spend, a super loaded Cadillac, and that's just
right.
out of the question. So then we're looking at all the different contingencies. So the whole idea is you have, and you yourself know, I'm not going to put words in your mouth. You tell me about that joint and where you know it needs to be.
Right here.
So when you bite down, that's where the joint needs to be.
That's exactly right.
And if you take it out and you bite down, then it hurts.
That's right.
And we don't know whether you'll be able to take it out and adapt where your joints have adapted to where you can actually touch your back. Those are things we don't know.
I do know that in a week's time that I'm not touching my back teeth. When I take my appliance out, I can feel how it's moved my jaw forward. That I'm not near as far back, and that's just in a week's time.
And you also mentioned about range of motion.
Yes, I can feel on a daily basis basically how wide I can open, how I can go from side to side, how that range is expanding on a daily.
And from now to years to come, if you could reach this level of comfort and maintain it, you're perfectly okay with that.
Yes, I am.
And I am too.
There's no pain, and there's just no pain.
Yeah.
And that's I didn't really realize I would get to be able to open my mouth back like I was, giving me the flexibility to open wide, because I could only open very little and move side to side. And I'm able to do that again.
And I didn't tell you that because I didn't know what the response would be.
That's right. You told me you weren't sure that would...
Right. But our number one goal was to get you out of pain. Which it did instantly.
It did, yes.
Okay.